This video will be discussing the disadvantages of telemedicine or remote working in general practice for both GPs and patients. This is the second video in a two-part series. If you haven't seen the first video discussing the advantages, then be sure to check it out. And welcome back to my channel. If you're new, then a massive welcome to you. My name is Dr. Baptiste and I work as a portfolio GP. Currently, I'm working in a remote role. If you haven't yet subscribed, then why not hit that subscribe button so you can be supported along your medical career journey, wherever you are. Be sure to also hit the like button if you gained value from this video. I'm going to start by discussing the cons for GPs and then for patients. So what are the disadvantages of remote working for GPs or staff? Some GPs feel that the shift to remote working or digital healthcare has been very fast or rushed, and so have not had the support they need to adapt as well as they would have liked. Some have found that it is difficult and hard in some cases to consult patients as some cues are lost, such as body language. This can culminate in a clinical risk. This could mean spending a longer time talking with patients over the phone or having to call patients for further information after spending time reading an e-consult. You cannot examine patients via remote methods, even with video consultations. It may be difficult to see the patient's issue or problem clearly, for example, a rash. Of course, you can ask the patient to record vital observations, walk around, change position or view so you can see them better. What about the lack of trust from employers if GPs are working from home? It might be harder to work from home due to distractions or working in isolation or overworking as blurring the work-life balance or boundaries. Perhaps there might be a loss of clinical skills if performing less physical examinations or seeing less or no patients face-to-face. There may be difficulties with technology, hardware, software, broadband or internet connectivity, which may delay clinics. This may mean that patients have to wait longer to be seen and the workload for GPs could increase or the day is delayed or pushed back. If staff are working from home, they must ensure confidentiality is maintained for patients. There may be a danger of the loss of team working or further working in isolation if GPs are working from home. So what are the disadvantages of remote working for patients? Patients may feel excluded if they have an impairment, such as a hearing, sensory or visual impairment, although GPs can use interpreter services, or if English is the second language or the patient cannot communicate well enough in English, although again, a three-way call can be used with an interpreter. Furthermore, some elderly patients may find it difficult, especially if they have several impairments such as hearing and visual impairments. Some patients may not be interested in using technology, even if they can access it, and or digital skills. This makes it more difficult to engage. There could be a lack of trust from patients, or they may feel that remote methods are not adequate enough compared to face-to-face consultations. We also have to consider that there are varying levels of socioeconomic circumstance. There may be difficulty accessing or being able to afford computers, tablets, and smartphones which are needed to engage with remote care. Patients have expressed that it may be incredibly difficult booking an appointment via phone, as phone lines may be busy when told to call in the morning. But there are new methods such as e-consults, which in some cases may mean that patients have a consultation with a doctor faster. Check out my vlog, A Week in the Life of a GP, for more information on the type of consultations. Again, there may be more difficulties with technology, hardware, software, broadband, internet connectivity. Patients may actually miss appointments because number one, they did not hear their phone ring, or they were busy at the time. Number 2, there was no specific appointment time. For example, in some cases with e-consults, the doctor may call at some point during the day. Number 3, sometimes the patient may not feel comfortable answering a call to a private number or withheld ID. In some cases, for example, if the GP is not at the surgery, so the surgery name or number does not appear on the patient's phone. Finally, due to convenience such as being able to complete e-consults online, there may be a problem that is presented to a clinician that may have resolved completely on their own in its own time. And this could lead to overuse and thus an increasing workload or longer waiting times for patients. Of course, it would also be useful to mention some key findings from a report by Healthwatch England. If patients fell into multiple categories as above, then the likelihood that they are excluded digitally would increase. For example, an impairment and poorer socioeconomic status. A lack of support from staff to enable patients to use online forms or apps, for example, Ask My GP, has been reported. Notes regarding their digital literacy on their medical records and support with how to use new digital methods such as apps and online forms. Overall, patients understood the need for the use of remote care, but wanted a choice and were worried that this would replace face-to-face consultations. There were a few key principles for post-COVID care, according to the report. Ensuring that there was a combination of remote and digital forms of healthcare, investment in support for those who have difficulty in accessing or using remote care. The House of Lords COVID-19 committee issued a report, Beyond Digital, arguing that the internet should be considered essential and that the government should consider a legal right to accessing the internet and therefore entitlements for this. So that is a list of some of the disadvantages for both staff or GPs and patients. What do you think about remote working? Let me know in the comment section below. I'll see you in the next video.